Hello and welcome to Vaccination Café. The number of measles cases has increased considerably in Europe in recent years, to the point where European countries are now exporting measles to the United States. What's going on and how can this trend be reversed? With me to discuss this today are Dr. Dina Pfeifer from the World Health Organization and Dr. Uwe Ehrentreich, a paediatrician from Germany currently working in Brussels. Dr. Pfeifer, first of all to you, could you give me an overview of the current situation with measles in Europe?
Well, in 2011 there were 35,000 cases of measles in Europe. It's actually quite a lot, considering that similar data were seen in 2003, and we did have a considerable reduction of the number of cases. However, we've been struck back with outbreaks. Some of them were seen in Bulgaria, in France, in Ukraine in last years, but also not as a widespread in some other countries in the European region.
And what are the reasons behind this? Why do you think the number of cases has increased, at least in some countries?
Well, there are multiple reasons behind it. One of them is that there is complacency, and children actually don't get immunized when they should, and when a very feasible solution is actually available, and that's to vaccinate. The second reason is hard-to-reach populations. They may be migrant populations, they may belong to minority groups, but also some groups that do not accept the vaccination because of either religious or philosophical reasons. But also we have a part of population which belongs to adolescent population or younger adults that were not immunized according to the current policy for immunization, which is with 2 doses of measles containing vaccine. And they are only partially immunized and should actually be given an opportunity for an additional dose.
As a doctor, you see a lot of patients every day and a lot of parents of young children. Do you think there's some degree of complacency or changes in the attitudes that parents have to measles?
Yes, to my knowledge, I think that the vaccination program has been a success partially. Maybe 20 years ago we had a very strong will to vaccinate as much as possible children, and nowadays people don't see the disease, so they don't think that it's of their concern. I hear often that people say, oh, we don't see that disease anymore, so it should not be there. The misinformation, I think, is one of the biggest problems I see now.
So measles is still circulating, but do you think some people still have the impression that, well, it's quite a mild disease, most people recover, so I don't need to vaccinate?
Yes, and that's, I think, the second problem to it. Not knowing the disease, not seeing the disease, you don't really know, because the disease is not the problem, it's the complication of the disease which is a problem. And if you haven't seen or you haven't known somebody who has had the complication of a disease, and that's the problem. You would think a child disease is something common. It's not a virus, it's not a 3-day fever thing. It's potentially life-threatening and damaging to some children who could get the disease.
And now we're at the point in Europe where last year a number of children did actually die and others suffered from some quite serious measles-related illnesses. Do you have any statistics on how many children might be affected by these types of side effects, let's say, of the disease?
There is an expectation to see at least 1 case of encephalitis following measles for every 1,000 children that got the disease. Also, conditions like inner ear infections, respiratory infections, the pneumonia within the measles infection, or diarrhea can actually come very, very serious and therefore require a hospitalization. Treatment of these cases is actually quite substantial cost, and in many ways dealing with the cost of an outbreak, it does accumulate to a large sum of money.
And measles is one of the main themes of the European Immunisation Week this year, amongst others, but another one is the role of health professionals. Why was this chosen as a special topic for this week?
It's a very important one. Healthcare professionals or healthcare providers are the first line that parents or vaccinees actually see, and where they get their primary information of the vaccines, of the necessity to immunize, but also about the vaccine safety. And they should be able to answer those questions and provide the information that the users, or the parents in this case, do require to make their decision on vaccination.
Now you are on the front line of this problem, I suppose, and you see parents all the time. What kinds of questions do they ask about vaccination?
I believe that the biggest problem in the last evolution is that there has been an enormous advance in technology and production of new vaccines. And I find that the biggest question I have is, are all these vaccines necessary? And people sometimes forget to, and maybe professionals also try to forget that what's most important. I think that we, as a professional, have to provide them the information. It's funny to say in this period where access to information is so easy, or seems so easy, that there is a lack of information in a way. So I think there's not a good communication.
And how do you respond though when people say, there seems like there's so many now compared to perhaps when they were children, there are now more?
I mostly tell them that, of course, that seeing less diseases, like some diseases which have been eradicated completely, are mostly due to a very systematic vaccination, and we should be happy about that. And whatever vaccine is new on the market, which is safe, which is controlled, which is scientifically proven, should be taken in consideration.
But Dr. Pfeifer, on that point about having questions about there being so many, it would seem more vaccines on the schedule than there were 10 or 15 years ago. How do you reassure people, parents who have those concerns?
True, there is a perception that there is perhaps too many vaccines being put in an immunization schedule. A newborn child has to encounter a lot of antigens throughout the initial phases of their life. This is either by inhaling it, putting it into their mouth, getting it through the skin. And the vaccines are only a very small part of a number of antigens that they encounter on a daily basis, which can be anywhere between hundreds and thousands. So the vaccine really only to minority contributes to the overall new encounters in a single day that an infant actually has in the initial phase of their life.
And just in terms of keeping this sort of conversation going with parents who have questions and concerns, many of whom will vaccinate but want to ask you for reassurance first. Is there anything you can do when people leave undecided? Can you direct them to, can you give them literature or send them to websites that you trust? How do you keep that conversation open?
Well, it's difficult because it's difficult to give a global image, but I think that people probably, when they come to an office or a clinic or whatever, they don't always remember what you say. I mean, that's something that's known in other situations. And I think that the best way is to give them a leaflet or something they probably can carry with them, or a website, but then have an official website, controlled website.
So I guess it is a question of balancing risks. These decisions are all about trying to have some understanding of the risk that the disease poses.
That's for sure. People accept that vaccines are probably 100% effective and 100% safe. They're very effective and they're very safe. Yes, in a very small number of cases, there might be vaccine-related side effects, but they are so much rarer compared to the actual risk of the disease and what that one brings into. So there can be quite a substantial differential in between the risk that is imposed on a child by the disease itself compared to the actually extreme rarity of a severe event as a consequence of the vaccination.
And is that, I know that World Health Organization has produced a couple of things for European Immunisation Week. One actually is a leaflet for doctors to help them respond to difficult questions from parents, but another is advice for parents who've decided to opt out of the vaccination schedule. And I know this includes some things like always tell your doctor and tell the creche, tell the school. Why did you feel it necessary to produce this? Do you think there's people who are not fully aware of the dangers they carry?
Well, sometimes we tend to believe that we are the only ones on the earth, but there is and there should be a sense for the responsibility towards the community. And if the parents decide not to contribute to the community health by immunizing themselves and their children, then at least what they could do is inform their environment that their children are not immunized, and if they are ill, certain measures can be taken to prevent that the disease from these individuals is not spread to the others. This means to isolate them in the doctor's offices or at the wards. So at least knowing about it already helps to do interventions which help the community.
But is that a difficult message to sell to people, is to convince them to do something which is for for the wider community benefit? Do you have to try and convince them that it's really in their own interest to do these things?
It goes both ways, because of course it's important to think about your own benefit. And you would do this by accepting or rejecting an immunization. But you also do benefit from the community, from the herd immunity. But it's not tangible and it's not measurable. But certainly it is there, and it's reflected in the fact that the diseases are not circulating around. We do not have outbreaks of poliomyelitis anymore because we had a very stringent immunization policy, and we are almost at the verge of actually eradicating the polio worldwide. European region is polio-free for 10 years, and it's a great success.
But I guess one of the unfortunate side effects of pushing back some of these diseases is that patients haven't seen them, certainly doctors haven't seen them, and maybe even the newer generation. There was a study, I think earlier this year, saying that the newer generation of doctors had a much more complacent view of vaccine preventable diseases. Do you think that's a fair thing to say? Do you think younger doctors are a bit more relaxed about the risks?
Well, I think that if you don't see the disease, if you're not confronted, as with many things, you probably might think it's not very important. And that's why it's important that we keep up with the knowledge that we have. I think that, as I said, is probably try to show people what the disease can be. They don't always have the chance to see it in live, so we can probably use video support or images or pictures or whatever seems to be important. Yes, I think that if you don't see, but that's true with other things too, so that's how human being works. And but as the colleague said, I think that the contribution to also the health, population health is very important. The global, and that's very important, that when somebody comes and says he refuses, I would say you don't only put your child at risk, but you put the whole community at risk.
That's a good final message for parents. Would you have a final thought even for healthcare professionals?
Sure. Get on the top of the subject, understand it, and become a credible advocate for immunization towards the parents and other members of the public. Consult them in an adequate way, and that's certainly going to get to the overall success of either eliminating or much better controlling communicable diseases which are vaccine preventable.
Well, that's about all we have time for on Vaccination Café for this episode. Our next episode will look at flu, so please come back and join us for that. In the meantime, don't forget to take a look at vaccinestoday.eu and follow us on Twitter. Thanks very much.